Hey guys, today I'm Hoàng Phú Quý from Vinh Medical University, a university of Vietnam. Today I'm pleased to introduce to you a lesson from my collection of video about medication. Today will learn about OAP. That is abbreviation of edema, acute pulmonary. So let's start about our lesson today. One, the first we have to know about the definition of the disease. Pulmonary edema is fluid accumulation in the tissues and air space of the lungs. This is a disease you have to undergo many times in emergency department. You have to quick assess and diagnosis to treatment right away to rescue the patient from the death. And it leads to impaired gas exchange and may cause respiratory failure. Yes, this definition and that is the result of the disease. It impairs gas exchange and may cause respiratory failure. Okay, we can go to the next slide. In the image, you can see it's normal lung of normal people. Yeah. The function of lung is exchange gas from the air to your blood, exchange oxygen and carbon dioxide to and supply the nutrient to the activity of our body. And you can see this alveoli, and this is accumulation of fluid in the alveoli. Yeah, you can see water such as fluid in this alveoli. A little fluid. And now you can see in the slide the causes of the disease. I separate it into two causes. The first is cardiogenic and the second is non-cardiogenic. The first, cardiogenic, the main causes consist of cardiogenic shock, acute coronary syndrome and heart failure, HCF and HF, hypertensive, acute heart failure, especially left heart failure, acute decompensated, chronic heart failure, and right heart failure. Be non-cardiogenic. I give you some advice, example for you to easy or understand easily. First, you can see this is in patient with smoke inhalation, patients with head trauma, ARDS, and severe infection such as sepsis. Now we can check the knowledge and gain more and understand more about mechanism of this disease. You can see normal lung. The picture, yes, the picture is normal lung. We have alveoli in normal state. You can see capillary. Capillary is surround the alveoli and receive oxygen and transfer opposite carbon dioxide from capillary to the alveoli. After that, you can see perimicrovascular interstitium. It is space which fluid from capillary filtrate into it and move or flow from perimicrovascular to peribronchovascular interstitium to the lymphatic drainage. Yes, it's normal. And you can see next picture. B is cardiogenic pulmonary edema and C non-cardiogenic pulmonary edema. In B, you can see there's an increased hydrostatic pressure PMV in the capillary, and the result is increased fluid filtration to the interstitium, and that fluid moved to peribronchovascular edema fluid that increase lymphatic drainage. As you can see, endothelial barrier is not impaired or not destroyed, but in non-cardiogenic pulmonary edema, it has normal hydrostatic pressure. It has normal, I repeat that, normal hydrostatic pressure. And the difference is it has disrupted or impaired or reduction of endothelial barrier, so that's permeability is increased, so that many molecules such as white blood cell is neutrophil can move from capillary to interstitium, and alveoli flooding due to increased epithelial permeability. So that if you have fluid from alveolus, you can see the difference. The fluid in cardiogenic pulmonary edema alveolus, it has protein poor, and in contrast, non-cardiogenic pulmonary edema has protein-rich edema fluid. Yeah, you can see the color different from two stage. But a common result is that people feel shortness of breath because when fluid is full of alveolus, it can make a block for the oxygen transport from alveoli through interstitium move to the capillary to bind with hemoglobin, so that people always hypoxemia. Hypoxemia is a state of low oxygen in the blood, and people feel shortness of breath, and many people die from these causes. So this last lesson of today it's the first my video, so I hope you enjoyed. Thank you so much for my presentation. Thank you for attention. Goodbye and see you again.